Welcome back to Connected Rheumatology. I'm Dr. Elizabeth Ortiz. I'm so glad you're here with us. Here at Connected Rheumatology, we talk about all things rheumatology, immunology, diet and movement, and mental health and wellness because we believe it's all connected. Today we're going to be talking about all things arthritis of the hands, specifically osteoarthritis. We're going to talk about how you can tell the difference between osteoarthritis and rheumatoid arthritis. We're going to talk about some of the more common symptoms, and most importantly, we're going to talk about what you can do about it. If that sounds interesting to you and you like hearing this kind of content, make sure you subscribe, like this video, share it with anyone you know who is suffering from arthritis of the hands or has a lot of questions about arthritis of the hands. It really helps us get in front of more eyeballs and really helps us out. So let's get started. So these are the top 5 facts about arthritis in hands. So let's just get into it. Number 1, not all arthritis is the same. One of the more common questions or consults we get in rheumatoid arthritis, aside from the positive ANA question, is what's going on with my hands? And everyone is naturally concerned about rheumatoid arthritis. And so being able to differentiate those two is really something that all rheumatologists do on a daily basis. So what are some things that you can kind of clue in on to try to help you figure out what you might be dealing with? Well, let's start with how they are the same. What are some of the features that they share? Well, obviously, they both can affect the hands. They both are associated with pain and stiffness. They can be associated with pain and stiffness in the mornings. They can be associated with muscle weakness and with losing our grip strength. So like opening jars and that kind of thing can become difficult. They can be associated with changes in the appearance. And that's actually kind of what I have noticed makes people worried is when they start seeing changes in their hands. But that's really where the similarities end. Rheumatoid arthritis is a systemic autoimmune inflammatory condition. So yes, it affects the small joints of the hands, but it also affects almost every other part of the body. Almost every joint can be affected. They can be inflamed, hot, and red, and patients will have fatigue, they can have fevers, and they can have a whole slew of other complications from rheumatoid arthritis. And we have videos where we talk about rheumatoid arthritis, and I'll put those links in the description box below. Osteoarthritis, by contrast, is a degenerative joint condition. This is a condition where the cartilage of joints can wear down and cause pain and stiffness. And as troublesome as it can be, it is really a condition that is confined to the joint and doesn't really affect any other parts of the body. Now, being able to differentiate between an OA hand and an RA hand is really, like I said, what rheumatologists do all the time. And a lot of that comes down to which joints of the hand in particular are being affected, because there is a difference between OA and RA. So when we're talking about RA, the joints that are most commonly affected are going to be the wrist and the knuckles here that connect our fingers to our hands, and we call this the MCP or the metacarpal phalangeal joint. So our MCPs, our wrists, and this first knuckle, or not the first knuckle, I should say maybe like the middle knuckle of our fingers, called the PIP or the proximal interphalangeal joint. Those are really the most common joints to be affected in RA. They get hot, swollen, they can turn red, and those are the joints that really kind of clue us in that maybe we're dealing with RA. An OA hand is going to look different. In osteoarthritis, the wrist can be affected, but not nearly as often. The big knuckles, again, can be affected, but not nearly as often. The knuckles that are most commonly affected are, again, going to be those PIP joints, so those knuckles in the middle of our finger, as well as the knuckles at the end of our finger, the DIP, or distal interphalangeal joints. Those knuckles can get swollen, they can get really big and bony, and that can clue us in that it's an osteoarthritis that we're dealing with. Now, the other, actually most common joint to be affected in osteoarthritis is going to be the base of our thumb. This is really a classic area of osteoarthritis. It can really be quite swollen and painful, and can also be another driver to send people to a rheumatologist. So I spoke about this change in the way our hands look. So with rheumatoid arthritis, the hands, the fingers can tend to drift off to one side. Usually, I guess you could think of it as like the outside. And in medicine, we call this an ulnar deviation because this is the ulnar bone and they kind of drift that way. So they kind of drift off to the side. You can get these really big swollen knuckles here, the big knuckles that then leave our hands looking a little bent like this. And there's a lot of other more specific, we use the word deformities, but I really hate that word, changes to the hands and the fingers that can happen. That's probably beyond what I really want to get into with this video, but just know that the changes that can happen with rheumatoid arthritis are very specific. Osteoarthritis does not get those kinds of changes. The changes that we see with osteoarthritis are really kind of this bony hypertrophy overgrowth of our knuckles, of our fingers. And so what we're left with are kind of a knobby knuckle look. They can look swollen, and they can actually require that we change the size of our rings because we can no longer fit our rings over our knuckles. But it's not going to be the same kind of drifting of the fingers that you see with rheumatoid arthritis. All right, so the rest of the discussion, I'm really going to be focusing on osteoarthritis of the hands and what happens with osteoarthritis of the hands. And getting back to the thumb. The base of the thumb is the most common area where we get osteoarthritis. It is the hallmark area. So when someone comes and they're like, this is where I hurt, I don't even need to look at anything else and I know that that's osteoarthritis. I'm speaking totally from experience because I've got it. I've definitely got osteoarthritis at the base of my thumb. It tends to affect the dominant hand more than the non-dominant, which is true for me. I am right-handed. And this entire area can look swollen. It feels bony. The tendon that runs along the thumb and onto the wrist and the forearm can become inflamed. It can, the pain can worsen after using the hand, so typing or using our phones or those kinds of things can aggravate the pain. And on inspection, when we look at it, we can see that the hand shape has changed a little bit, and everyone's different. And some people it's going to be more severe, and I'm not sure you're going to be able to appreciate it on my hand because it's not super severe. Of course, I notice it because it's my hand. But what we see here is at the base of the thumb, this joint, this bone starts to pop out, and we call that squaring of that joint because it kind of has an angle to it and looks like a square. And so that's the beginning of osteoarthritis. And so yeah, that's what I've got it too. It's very common. The third thing is when we're talking about osteoarthritis of the hands, it really is all in the family. There is a very strong genetic component with osteoarthritis of the hands. And I will oftentimes ask when, speaking with a new patient and talking about their hands, and I'll ask if their mother or father had osteoarthritis of their hands. And a lot of times people won't remember, or they'll say, well, they never really complained about it. And then I'll ask, do your hands look like your mother's hands? And that question will usually get me the answer I need. And even if the person's never really thought about it before, just a quick kind of thought and then, gosh darn it, They do look just like my mother or my father's hands. We know osteoarthritis can affect any joint. We often think of it as like a bad knee or a bad hip or a bad back perhaps, but there is a whole subset of people who deal mainly with osteoarthritis of their hands, and that kind of flavor of osteoarthritis has a very strong family and genetic component. It's not uncommon for me to be seeing a patient, let's say a woman in her 40s or 50s who has osteoarthritis of her hands, and maybe she takes care of her mother, and so her mother is there with her at her appointment, and sure enough you see her mother there with her osteoarthritis hands. And of course, because we all live in complicated times and we have to take care of lots of people, maybe she also brings her daughter who is in her teens, who is there in the corner on her phone, like annoyed that she had to come to this appointment. And all of a sudden, I can get her daughter to perk up when I start talking about this family connection of this particular type of arthritis. And if grandma and mom have it, there's a very strong chance that the daughter will have it. If there was something we could do that could prevent the bony changes, I would be doing it, because as you can see, I am in that boat. Both my grandmothers on both sides of my family had pretty significant osteoarthritis, and so I'm on borrowed time. The one thing I will say from my knowledge as being a rheumatologist and knowing arthritis is that there is actually a lot we can do in our lifestyle to try to offset pain. So we might not be able to do much about the development of the bony changes, but there is a lot we can do for pain, and I'm going to get into that in my last point. All right, so what can we do for the arthritis? So once we've developed the arthritis and we're having some pain and we're having some weakness, what can we do about it? Well, unfortunately, we don't have a cure. We don't have any pill or any injection that can change the changes that have happened to the anatomy or change what's gone on with the joint. The only thing that can really do that is surgery. And certainly for severe cases, we do have orthopedic hand surgeons that can actually do wonders at shaving down a very severe angle or fusing or even replacing some of the very severely damaged joints. They do it a lot in rheumatoid arthritis, but depending on the severity and the limitations and pain a person is experiencing, they can do it with osteoarthritis as well. But aside from surgery, there's nothing else that's going to change the joint. So our focus is really on preserving function of our hands and our joints and improving pain. And so that's really, all of these treatment strategies are really focused on that. So we have topicals, so we have pain ointments, and they come in all different kinds these days. We have prescription strength anti-inflammatory topicals, over-the-counter anti-inflammatory topicals. We have Tiger Balm and CBD and all kinds of different concoction and ointments that will help with pain. Obviously, then we have our oral anti-inflammatory and pain medications, things like ibuprofen and acetaminophen and naproxen and diclofenac and all of those things. Once you get beyond the oral medications, then we get into the injections. Just like with knee osteoarthritis, you can do steroid injections, there's PRP, now there's stem cells. You have all these injections at your disposal, and you can inject the small joints of the wrist or the hand. Obviously, it's going to be a different type of injection. You're not going to use nearly as much medication, and the needle is going to be a lot smaller. The injection itself can be a little more uncomfortable because the joint space that you're trying to put the medicine in is smaller, and so it can hurt a little more is what I'm trying to say. It's a nice way of saying it can hurt a little more, but those are options. Now, steroid injections, I know a lot of hand surgeons would agree with me when I say I do not think they are something that should be done repeatedly. I think when we're talking about the hand, it's a one and done. Again, I want to talk about how PRP and stem cells do not have rigorous or robust data supporting their use. after we have our topical and we have our oral and we have these injections, which I've kind of told you aren't really that great to do, then what are we left with? Because you know what, doc, I still have a lot of pain. I still can't open anything. Like, this is miserable. The thing that in my experience and the data shows has the best long-term benefits is physical therapy. When we develop osteoarthritis of our hands, we will also start developing weakness of these tiny muscles in our hands that help us grip, help us move, help us use our hands. And that weakness can then snowball into worsening pain, and it becomes this vicious cycle. So building up your strength of your hands actually helps improve your pain and obviously increase your function. So physical hand therapy is key to keeping your function and improving your pain. And the thing about hand therapy is, based on where we live, based on our insurance coverage, we might not all have access to kind of state-of-the-art hand therapy. And so what I found exciting recently is the use of technology to try to bridge that gap. There's one particular company that I've had the pleasure of kind of getting to know and working with, who have developed an app to gamify hand therapy in particular. And what they've done is really, I think, quite interesting in that using a smartphone camera in this app, they've developed these games that I guess are kind of like, they look like Candy Crush, although I've never really played Candy Crush, but they're these games that you control through various movements of your hand that your camera is able to read. And the movements of your hand are movements that would be prescribed by a hand therapist in order to improve your strength and your range of motion. And it really, I think, is just a sign of where we could go that could then make these types of therapies so much more accessible to so many more people. And I actually have a link in the description box if you want to go check it out. It's absolutely free. And the key thing about this other, which I forgot, is that it puts you in contact with a therapist that you can then chat with and have appointments with and kind of talk about your progress. So something to keep in mind. And I just think a sign of the exciting things to come in the future. And then finally, I just wanted to spend a minute differentiating the difference between arthritis and pain, because they are different. Arthritis is a degenerative joint condition. Pain is actually something different. And just because you have arthritis in your family or you start to see changes in your hand doesn't mean that you are destined to a life of arthritic pain. What we know about the way our brain processes pain is so much more advanced and nuanced than it used to be, that now I can firmly tell you that there is science to back up what I saw in clinic, and when I continue to see in clinic every day, which is I see patients with bone-on-bone arthritis who are living their lives pain-free without needing a bunch of pain medicines. And it kind of was this thing that we all saw, we really couldn't explain, but now understanding better these pain pathways and all the other things that impact those pain pathways, we now have a better understanding of why we were seeing what we were seeing. And so what are those other things that impact pain pathways? It's the same things I'm saying all the time. Healthy, regular, restful sleep, quality movement, and again, I'm not talking about hand therapy movement. I'm talking about movement out in nature, movement that gets your heart pumping, movement that excites you. Good, healthy, sustaining relationships. These are relationships that bring you to life, not drain you of life. And stress management. This is things that bring you joy. This is calming the mind, bringing your cortisol level down. And then, of course, a healthy, varied diet. All of those aspects come into play when we're talking about how active and how activated our pain pathways are. I hope I answered a bunch of questions that I know are commonly asked in rheumatology clinics. I hope I provided a little insight for you and you can look into your own family and see what everyone's hands looks like. And I really hope you take a moment and check out that link for Reactiv, that virtual hand therapy clinic. I think it's really cool and an interesting sign of where we're going in the future. If you like this video, please hit like. I'd really appreciate it if you subscribed. It helps us get in front of more eyeballs. Here at Connected Rheumatology, we talk about all things rheumatology, immunology, diet and movement, and mental health and wellness, because come on, it's all connected. Have a great day, and we'll see you next time.